So I've hurt my back and I'm looking to stay active and continue to train. What should I wind up doing to stay fit and healthy? Hey, my name is Dr. Greg Gersten and I'm a chiropractor and I help people to lead amazing, fantastic lives without drugs and surgery. Today I want to talk with you about a question I got asked today. It was a patient who had come in and had some difficulty with moving some boxes. They actually redid the epoxy floor in their garage and they moved things from one side to the other, and she was really in a lot of pain, but she wanted to continue to exercise and stay fit. Now, this is something that I've run into with a lot of people, and the challenge that you wind up running into when you are injured and you continue to exercise or try to be fit on things and not allow things to fully correct and heal is that you're winding up working and wearing on injured or damaged tissue. So it's going to continue to become injured and damaged, and your body's going to become desensitized to that pain. What I've found is really important is that when you've had an injury, you need to address the injury. But we do need to figure out ways to keep you active and mobile. So you're not going to be able to necessarily participate in the level of sport that you were, but we do need to keep you active and mobile. If you've been curious about how you can stay active and mobile when you've had an injury, this is really important for you. And it's really important because if we don't wind up setting that solid foundation for your health, we're going to run into things called false starts. And that's where you wind up having an injury, you give it some rest, and then you wind up slowly working back into your sport. Then you get injured within a couple of weeks again, so you rest it again. And then you slowly work back into sport. Then you injure it again. And then you rest it for a while, and you slowly work back into sports. This turns into frustration, and for many people, they then stop being fit and active, and it leads to difficulty with other health conditions and getting motivated to get back active. The key to figuring out how to manage this is to work with the right professional to guide you into setting a solid foundation for your health and then building upon it for the rest of your life. If you need help finding someone like that, go ahead and write down below. Once again, my name is Dr. Greg Gersten, and thank you for letting me be a part of your health.